Good afternoon. My name is Dr. Dee Roach, Mitchell County Hospital. Here to talk this afternoon about the current status of COVID-19 in our community. As you have most likely heard and seen, our numbers of increasing infections have certainly been substantial here over the last 2 to 3 weeks particularly. We are seeing a significant increase in the number of positive cases that we're testing through the clinic and through the hospital here. I don't think it's terribly a big surprise that this is happening, and I think in fact it's probably anticipated. We had been discussing earlier in our visits that as cold and flu season starts coming along, we're going to see an increase in number of respiratory infections. The challenge, of course, is discerning which is COVID, which is flu, which is some other seasonal related illness. As a result of our testing, though, we certainly have seen an increase in the frequency of positive testing reflected in the community. We're also seeing an increase actually in hospitalizations of patients who have COVID related illnesses. And so mostly just to inform the community, this is the time that we need to be serious about complying with the things we know to do. And Jennifer Hale is here with me today, and she's going to go over some of those things with you once again, just to reinforce what we as a public need to be doing individually and collectively.
Thank you, Dr. Roach. Yes, I'm in charge of infection control, so we've been very busy with the increase in cases, and our hope for our community is that we can all come together united to put up a good fight against this virus. We know it's here. We know we're navigating it daily. We're probably coming in contact with it daily, and how can we prevent this spread from continuing? I want to encourage everybody to continue wearing your masks. It is droplet transmitted. So if you're wearing a mask and you have that barrier, there's a great chance that you wouldn't contract it even if you did come in contact with it. In conjunction with that, staying home if you're sick. If you do have symptoms, then stay home if you're sick. Contact your healthcare provider to follow up and see if you need to be tested. We also have our COVID hotline available if you have any questions, 728-3431, extension 7070. Please leave a message if we don't answer, and we'll get back to you with your questions or concerns. We also want to encourage you to increase your hand washing. Any contact that you make outside your home, grocery shopping, going to the bank, whatever you're doing, pumping gas, make sure you're sanitizing your hands and washing your hands and preventing the spread of those germs, because you just don't know when you're going to come in contact with it. Large gatherings, that's something that needs to be discussed with whatever group you're gathering with, because it may be a good time to maybe reconsider having those large gatherings and holding off on them. And if you do have the large gatherings, encourage people to wear masks and social distance as much as possible, so that you can have them safely. As Dr. Roach said, we've had a big spike in cases. The health department from Sweetwater, who covers Mitchell County, reported 44 active positive cases. And if y'all remember, back in July, we had a spike in cases, and it was up in the 20s. And we were encouraging you to be cautious then, and we want to encourage that even more now. COVID's not going away in the near future, so we need to just learn how to navigate things a little differently now, a little more cautiously, and consider your neighbors, consider your friends and family that live in the community and outside the community, and practice those safe measures so we can get through this safely.
We know from our medical community, we know that the public is very frustrated with all this. We know that they're disappointed in having to continue to exercise these precautions. We truly understand it. We share it with you, in fact.
Yes.
We would just want to reinforce with you that this is the very time that we need to exercise these precautions the greatest.